What I want to talk about is really some of the places of where we have prevention activities. I can talk a great deal about what the work is of the Child Abuse Prevention Center and a lot of the work that's happening in our communities, but I wanted for you guys to really give a little bit more of a macro down to a micro analysis of some of the work we do, and really focus on 3 different areas. Thank you. Prevention that happens in families, prevention that happens in schools, and prevention that's happening in community and government partners. And use the work that we're doing in San Francisco as really an example of this, but you can find this work in every community throughout the country because, as you know, child abuse is happening throughout the country. You guys know these statistics far better than I do at this point, but I was talking to my board recently around the fact that in our country, every 47 seconds a child is maltreated, and then at the end of that hour-and-a-half meeting, my board member, who's our audit chair and accounting guru, said, well, that is, and then repeated the number. So I think throughout this I'm going to both share numbers and stories, and I think as you're probably reflecting with your colleagues in this class is how do you really tell the story of prevention and how does that work? But I wanted to talk about families initially and where we do prevention, and we really look at the work in at 3 different levels. One, screening. How do you identify kids that are at risk or exposed to violence? Assessment. How do you figure out what's the level of services that that family and child needs? And where do you want to get them to in order to ensure that they're safe? David's going to talk a lot about a prevention model, triple P, I think, that we use at the center. Last week you spent some time talking with Susie Loftus around adverse childhood experiences, ACEs screenings, and some of the work that they're doing at the Center for Youth Wellness to really identify kids that have been exposed to violence. And so when you're thinking about this, you know, it's not, many kids are coming to the system, right? Child Protective Services report, but many kids are really hidden and sort of under the radar screen. And so it's really important as you're thinking about a comprehensive model, thinking about where can you find these kids and how do you screen them for services. One of the things that we're doing this year in particular, in addition to some screening tools, is really thinking around assessments and how do you provide the right level of services for kids. And so there's many different tools that are out there. Each tool tells you something slightly different, but before you start layering on intervention services, it's really important to think about where families are and those things. And finally, and I want to spend a little bit of time, and you may, have you guys learned about the 5 protective factors? 5 protective factors? Okay, so yeah. You have? No, we haven't, okay. No. So I'm going to spend a little bit of time with a handout. The 5 protective factors are what we're using at the Child Abuse Prevention Center to really think about intervention models, appropriate intervention models. This is an evidence-based tool from the Center for the Study of Social Policy, and it provides a framework for communities on how to do child abuse prevention. We're taking that framework for communities and applying it to families. And as you see in front of you, there are 5 protective factors. One that has to do with the child, and several that have to do with the parents, and then more the family. So for the child, we're really looking at how we can ensure a child has strong social emotional growth. And so we have a playroom. We're located in the Haight and Waller Street in the old Victorian firehouse. This little girl is one of our clients. She is there ostensibly for play, but our caregivers are really evaluating whether or not she is at an age-appropriate level, whether or not she's socially and emotionally secure, and if she's not, we're providing the right interventions for her and her family. The other thing that we're looking at for parents is, do parents have resiliency? Can they deal with sort of the inevitable ups and downs? I don't know if you guys have had a chance to read Paul Tuff's book recently. Yeah, that's a sign, yeah. One of the things he talks about is grit, right? And how do you get that grit? Well, that's the same thing that we're working on with parents. How do you get that resiliency, that grit to sort of, yeah, life is hard, life is great, life is hard, and there's sort of inevitable bumps, and particularly with the families that we're working with, extreme poverty, dealing with a loss of housing, loss of jobs, loss of health care, and what do you do in those bumps? And when your child comes home and is failed a test, or is is just sort of having sort of their own emotional crisis, how do parents in an effective and a safe way care for their kids? So parent resiliency is really important. The other component that we look at when we're providing interventions with families is really looking at, do parents have a really clear understanding of their kids' age-appropriate behaviors? So it's one thing for a 3-year-old to spill milk on the ground, right? You actually want the 3-year-old to keep dropping the bottle. That's age-appropriate. But if it becomes a 7 and a 10-year-old, then you want to have some safe disciplinary tools to, one, identify that it's okay to tell a 10-year-old, stop dropping your milk on the ground, it's time for you to pick it up. But you want to do it in a safe way. And often if families, and 85% of our families have a history of abuse in their family, either it's domestic violence or it's their own child abuse, you want to really role model appropriate parent education activities. So that's another main intervention model that we're doing. The other component, the fourth component, is we're really looking, are parents able to reach out to the community and get help? A key indicator of child abuse, as you guys know, is stress and isolation. And so how do you break down those barriers? Well, family resource centers like the Child Abuse Prevention Center, but others, are places where families can just get connected. I mean, as simple as we have a clothing closet there, and literally as simple as coming and picking your clothes over the holidays and finding a wonderful costume for your kids is a way to create a connection and maybe get some help on those kind of things. And the important thing is parents are able to know that they need it and find it. And many parents don't. Many parents have absolutely no idea. So it's one of the components that we really look at and we really try to provide appropriate intervention on. And then the final is a significant stressor, is does a family have basic needs? Do they have all the basic components that they need to take care of themselves and their kids? Daniel, when we were talking earlier, we talked a lot about, is child abuse dependent on the economy? And no, child abuse spans all zip codes, but yes, certainly if you're in a low-income situation and don't have the basic needs, and whether it's transportation or housing or jobs or food or clothing, it's going to be it's going to be much harder. You're going to have much more stress. It's going to be harder on you to take care of your kids. So those, when we think about our intervention models, we think about those 5 components. And you met Daniel Laurie last week. We're working with Tipping Point to be much more thoughtful about outcomes. And so how do we not only measure the number of kids we see and families we see, but how do we ensure that the families that we're seeing have all those 5 protective factors, that we work with them as a team to get those 5 protective factors, and if we fail, if the family fails, we fail. And so we want to hold ourselves accountable for those kind of components. So I know I think David's probably going to go into a lot more around different kinds of intervention, particularly on parent education, but one of the programs that we use is Triple P. It's a evidence-based model, as you know, and it's one example of how we might work with a family who needs parenting education, particularly in order to be able to get the holistic services that they need. Feel free to jump in if you guys have any questions, but I'll just keep.
Can I just ask one quick question? So if you look at, so of course this opinionator piece that you sent that comes out of your conversation with David Bornstein, right? Basically. So then of course it references this 2009 Triple P evaluation, and in it I was just really surprised. So they had this, so they said, for example, Theodore et al. Found in an epidemiological study conducted in the Carolinas that maternal reports of physical abuse from anonymous telephone surveying were 40 times greater than official child physical abuse reports. Okay, but what I'm interested in is there was not significantly different, it was not, harsh physical discipline was not significantly different for low versus high income households in this epidemiological phone survey. So it is. I don't really come across that literature very often. And you had said, the level of stressors is higher in these neighborhoods, and that's kind of what we've been going over continually. But I'm just wondering, to the degree, is that literature borne out in other places? Have other people done big studies like this where they're looking at the severity of abuse?
Dependent on the income level?
Yeah.
I'm not aware of any, but...
No, I was quite startled by that, which is why it sits in the book.
Yeah.
Because it certainly, flies in the face of our assumptions about what the world is like, and also the fact that, there are more stressors in the lives of poor families than middle-class families on average, right? And you would expect there to be, greater stress would produce greater, less capacity, less resilience. So I was surprised, but as you say, it's a large-scale study. One of the nice things about that kind of work is that it's a way of encouraging us to check our biases.
But did you find strong supporting evidence? I don't recall.
I found that study, which I thought was an impressive piece of work.
You found this itself,
right?
The one that's being referenced.
Exactly.
Okay.
That's where it comes. It's cited in the book.
Yeah. In Kids First, or the new book?
No, in Kids First. It's cited in that chapter.
In that chapter?
Yep.
Okay.
I think anecdotally what we're seeing is that the risk of child abuse and actual incidents of child abuse are happening across all socioeconomic levels. And some of the most severe cases actually are in some of the most privileged families. And so I think it is important to check yourself on certain assumptions that are made.
They're just less likely to find their way into the system for a whole variety of reasons.
Very true. And I also think when you're setting public policy and you're allocating scarce resources, it's really important to think about how you want to titrate those level of resources and how you get different services. But, for example, we're supporting a mother right now who is a victim of domestic violence, and the husband is extremely abusive to the children. We're working on a safety plan with her right now. They live in a very well-off area in San Francisco and have significant means, but the husband has actually sequestered sorry to use that word right now with all that's happening in Washington, but basically taken hold of all of her finances. So she herself is being economically abused and doesn't have access to be able to get away from the family. And so I think that it's important to look at those individual stories, but I completely agree with you that when you're looking at sort of broad-based level, it's important to look at economy.
Yeah, this thing makes it a little bit harder for us to, you start thinking that you've got all these targeted interventions, and you look at, of course, we often reference Emily Putnam Hornstein's work in this class, or I do, but it's important work looking at all the birth records, and and you see there seems to be the very strong correlation with maternal income as measured by Medi-Cal uptake. But that being said, I would like to find more of those big studies.
Well, as I said, the reason you're going to find those, abuse cases are going to be much more likely to show up among poor folks because well-off folks have lots of ways to stay out of the system that you're describing.
Yeah, but beyond
one of the reasons that I'm a Triple P fan is that it does not say parenting is we're worrying about poor families' parenting issues. And indeed, they would do everything they can to not have a group which is identified as parents who must come for counseling or else they will lose their kids, because that just cuts against the grain of what it is that they're trying to do.
Right. Yeah, it's interesting. Beyond the surveillance question, though, then there is the question of mortality and the higher rates of mortality among certain racial groups, surely, but then you think that there's a correlation with poverty. But the surveillance issue is huge. There's just less surveillance.
The framing issue, if you're talking to journalists, that's the news story, right? Poor parents are poor parents is the common expectation. So if you're writing a story which says there are a lot of rich parents who are poor parents as well, with fewer excuses, right? That's the story that you have. That's the, you know, that's the man bites dog story. And that, if I were a journalist that was coming to you and I was going to write a story, that's the story I would lead off with. I wouldn't be leading off with another welfare mom, to which the reaction is, what can you expect? It's another welfare mom. This is a quite different kind of tale. And since, I mean, generically, your job as writers is to build bridges to your readers, figuring out ways of writing about people who are like you, the reader, like your reader, not like them, is a way of getting them connected to the story.
I want to use that, if I can, as a segue to talking about a situation that happened in a school with a family that was very much like the reader, and to talk about some of the work that we're doing in our schools. So, to sort of, again, bring us back to context, we do prevention with families, and it's important to do that micro, individual level work. It's also really important to do the meta level work, the work in the community with schools, broad-based, where you don't necessarily know if the person that you're teaching around education is at risk of abuse. They may be, they may not be, but it's important that they get the information. And so we do a wonderful safety awareness program in our elementary schools in San Francisco, where we're teaching kids three basic words, 6 words: say no, get away, and tell someone. And I brought some posters around some of the work that we're doing. So we teach kids, we start in the 1st grade, how to say no. And then we teach them how to tell someone, how to find a safe adult in their lives who they can go to if they need help of whatever kind. And then we tell them to get away. So what happened with Penn State and Sandusky is you had families there where the kids were actually saying no. They were actually telling someone, but the community, some kids were, some kids weren't, and the parents didn't know who they should go to, and when they did, no one was believing them. And so what we try to do is create a safety web around the school and teach the kids, teach the parents, and teach the educators, so everyone's on the same page. So the story is in one of our local elementary schools, a 2nd grader at the time, 2 2nd graders at the time were in an after school program, and they were playing in the schoolyard, and a man came up, an uncle came up to the fence and started taking pictures of one of the girls. She was jump roping, and he called her over, let me take some pictures. And then a good amount of pictures. This went on for a period of time, and the man is asking the girl to change different poses and definitely creating up a rapport. And then the man asked the girl to call her other little friend over, Emily. And Emily went over to where they were. Emily was playing basketball. Went over to where they were, and Emily said, "You're an unsafe adult. I'm going to say no and get somebody." And literally went and got the head of the aftercare program, who called the police, who arrested the uncle, and he was then charged. And so we asked her afterwards, we asked Emily, how did you know what to do? And Emily said, well, Miss Molly taught me. Miss Molly taught me how to say no, get away, and tell someone. And this was a child who had been in a program for several years. We start in 1st grade. We go 4 times a year into the schools. We'll repeat every year up till the, depending on the school, up to the 5th or the 6th grade. We're in about 40% of the schools. We are seeing a 30% increase of child abuse reports from the schools where we're in, meaning that we like child abuse reports. That's a good thing. It means we've raised awareness. Meaning that we're actually educating the kids and the parents and the educators in those schools around how to, different from what was happening in Pennsylvania, or happening in that particular school community, and that was in the, hopefully, well, I'm not going to editorialize on Penn State, but how to find the people in your community to get help. Yeah.
I can interrupt you. I'm curious, because this sounds really similar to a program that was really big, I think, in the 80s, and this probably still going on. And I'm just I'm curious, is this program geared at having young children prevent sexual abuse or molestation, or is it like all around child abuse?
It started out, it probably was based on, in fact, we adopted a model that was created in Washington State, and we've taken it to San Francisco and gone through the public school system to ensure that it's an accredited, appropriate class for San Francisco Unified. And it was originally started around sexual abuse. We actually form a fundamental basis around creating norm changes around permission. We work a lot with little kids. It's all very age appropriate. We work a lot with the little kids on how to ask for permission, how to go up and ask to, go to the chalkboard, go to the bathroom, go get a drink of water. You need to ask an adult for permission, but equally, an adult may have to ask you for permission. And so then we talk about safe and unsafe touching, and what are private body parts, and we have a little doll that we use, and we have a boy and a girl doll, and it's okay to wash, a parent or a caregiver is okay to wash you, and talk through all that. It's evolved, and now we do a lot of work around gun safety. You'd be surprised how many kids in San Francisco, no matter where they go to school, have a gun in their house, or know that there's a gun in their friends' houses, know where it is, and know how to open it, open up the lockbox. And so we do a lot of work around permission and safety in that aspect. But it did start with sexual abuse.
Just kind of going back to that, so in terms of like the 30% increase in child abuse reports, what percentage of those have actually been substantiated?
Of our reports? Oh, I wouldn't know that, but...
It's not like a really good program, but I think one of the main critiques of the original program, maybe from when you arrived, was the programming, or the statistics went up, but they found that actually maybe the reporting was going up because certain people were being identified as doing certain things, because these little kids were being kind of educated around, I think, bad touch, good touch, and those things, and they couldn't really show that the child, like that kids were more successful at stopping the child abuse.
Stopping real abuse, or were they just creating stories? 100% you have to have appropriate interviews of a child, and I'll spend a little bit of time on that, to ensure that they're actually founded cases, real cases. But giving kids words to identify the people in their lives that are potentially hurting them definitely works. But it's a very good point to make sure we take a look at. I actually would like kids to report a lot and then have different interventions to make sure that the child is actually telling the right story. If a child's telling the wrong story, something's going on, and you want to figure out what's going on. It's not coming from increased awareness. If it's age-appropriate awareness, it's coming from something else.
So I'm remembering back to that period and the sex panic that set in, and the false accusations and ruined adult lives. As the other side, I mean, the problem is real and large and needs to be addressed, but you had, once you reach out to that larger adult enforcement system, and once you find yourself in the world of planting suggestions in kids' heads, you run into difficulties. The other thing that I know about anecdotally is that kids know that one source of power they have is to say sex abuse. And they use it as a way to get their own way. Because they're smart. And they realize what consequences can happen to adults. So this is very, obviously the problem is real, it's important. The kid is the person who's going to be, identifying it. I think the richer example in Penn, because those kids are a bit older, is all the priest abuse scandals. Which there are thousands of kids that we're talking about. How do you address the type 2 errors that are going to arise in this situation?
I address it with the adults on the other end, and do really effective non-leading interviews, because to close it off from the beginning, you're going to narrow the amount. You're not going to identify kids that are getting hurt. We have again, frankly, every day we have some issue. So we were at another school, and a child told a pretty horrific story about what was happening to their family and to her. And through a pretty rigorous interview process, we believe it really is that issue. Does that mean that family and that child doesn't need help? No. But it may not be a founded case of child abuse. And that's where I think a little bit of nuance and appropriate interventions along the line are appropriate, because probably that child needs, and family need, parents need mental health and counseling support, some kind of age-appropriate education on what's going on. But it's still important to be able to give age-appropriate information to children. And I think that's the difference about that there's been a real evolution on curriculum on giving age-appropriate information.
I just have a quick question. Just so have you had any pushback from the department in DCYF and San Francisco saying like, oh, the reporting rates are jumping up? Have they said anything like, oh, we're overburdened as it is? Have they said anything like that to you or no?
We are in constant contact with CPS on it, Child Protective Services on it. Yes, they like it. We actually decide to go into schools based on close collaboration with the government. We identified to go into schools in two ways. One, child abuse reports are significantly higher than other schools, and that is a red flag for us, or they're way too low. And so we work in concert with Child Protective Services to get at the question that you're asking is what schools have founded and unfounded questions. For confidentiality reasons, I don't know the answer to your question. But it's a really good question to look at a little bit deeper.
Well, it's interesting because you see there's the different reactions. I mean, in Minnesota, that what the dean of the School of Social Welfare was talking about was that they created domestic violence reporting laws. So you've got a case of DV that comes in, so the co-occurrence is so high that it makes sense to send out a CPS worker to make an evaluation. But then there were so many more evaluations that they had to do that they started complaining, so much so that it was taken off the books, right? So you had pretty good reason probably to do investigations, but there was just the resource issue. So I'm just curious.
Have you guys looked at structured decision making?
I mean, we haven't talked about it explicitly in this class, but that's something. Yeah, I mean, I know about it. But.
So structured decision making is a process that Child Protective Services goes through when they have a child abuse report, and it's both a strength-based model and a risk-based model, and it really basically evaluates where a family is and the level of risk that family, and answers Daniel's question of when is it appropriate to go out and investigate a case, or when is it appropriate this is an unfounded case. And they divide it up into 3 different paths. What they really try to do if it becomes an unfounded case, and a lot of it truthfully is based on their own capacity. I mean, they want to be successful in their job, and so the numbers have to correlate to a certain level of their own caseload. But structured decision making allows for non-founded cases or cases that don't even get that far to go to community-based organizations, with the idea that we really want to connect families with social services that can provide them help and support. And so in San Francisco, and that's the one I know the best, but this is happening across California. We're really trying to create close partnerships with Child Protective Services, because with the idea that to prevent abuse, you need this whole spectrum. You need from families to schools to communities to the government. And how do you think of a thoughtful way of putting families in the right level of services?
So you talk about nuance and thoughtful. I would be delighted if we could clone you and put you every place in these organizations. But what's your general experience with CPS? Because nuanced and thoughtful are not words, they're not adjectives that come to mind when I think about Child Protective Services generally.
We have a critical friend relationship with our child. With Child Protective Services. They're doing the best they can. They're completely under-resourced, and they have high caseloads. But fundamentally, I think that the Child Protective Service workers are doing the best they can. And they're trying to reach pretty tough federal mandates to do it. And if you look at different ones, they're in different places. But could they be doing a better job? Yes. Yes, but I also think it's all of our responsibility. as you indicated earlier, I'm a government employee previously, and so that's my bias. Is I think it's really important not to say, oh, it's the government's problem. It's all of our problems, and so we have to. That's why we like our role as critical front, right? You got to point out where the problems are. My colleague, who's been in this field for about 40 years. Who really is a thoughtful, nuanced person, was very, very harsh and critical of our local child protective services, particularly the emergency hotline, over the past decade because they weren't picking up calls and having a lot of unfounded cases. And so I think it's really important to create that partnership with the city. So, I probably talked for too long. I could go on for a long time, but
I think having a conversation is rather. I'm happy with that.
Okay, that's fine. That's fine with me. I mean, I think it's, I think it's interesting that you've been able to penetrate so many school districts to take this idea there. So I mean, for all.
Let me be clear. One school.
One school district. One school district. But I'm
right.
saying you're in. What did you say?
We're in 40%.
40% of the schools. So you've done a very good job of getting out there and becoming a part of embedding yourself into the school system.
Right.
And in terms of child abuse prevention and how do you go to that place where you're replicating, and this is something for you to think about too. I mean, you're the big thinker on this stuff, and how do you replicate big system change? And so how do you do it here in San Francisco effectively, and then how does that correlate out, and what are we seeing in terms of actually getting to a place where where we really are talking about a culture of parenting, not only the child abuse prevention side, but this idea of parenting as a bigger issue governmentally, and that's maybe where you can take it.
In San Francisco, it's such a richness of resources. So if we move to Richmond, not so very far away,
right.
You're going to get a very different story. I don't know. I mean, this is so you're in the world of people changing. All of this is about people changing. And you're in a low status part of the world of people changing. And you're in a world that happens to require a lot of nuance and subtlety. I'm not saying anything you don't know. I'm just flagging the complications. So the question is, how do you devise a system that isn't, how can you devise a system that's more rugged than this? That's going to work in Salinas and Stockton and Richmond and East LA and all sorts of places that don't have all the resources that San Francisco has. It's a crucial question, which I'm sure you wrestle with all the time. How do you get away from the Cadillac model and produce a Kia that actually is going to motor its way through this landscape?
Well, I think when you're talking about Triple P, I think that's a pretty significant question there. Fundamentally, I think we have to have a norm change in our entire society, right? So a movement has to be created. So I have a 10-year-old and a 13-year-old. They are amazing at recycling. They know exactly what to compost and when to do it. And I sit there, and I did it today, like, where does the tea bag go? What is it? Is it compost? What is it? They're like, whatever. So, but that's because they are learning it every day, and when they go to school, they have to recycle their stuff. I think programs, and I really want to be conscious of what you said and how to think about the solution on that, but I think fundamentally we need to be teaching kids and parents early on to make a cultural norm change, and that's not going to be easy to do, but I look at global warming and turning off the lights and wearing your seatbelt and say no to smoking, all that. Like, you could do public awareness campaigns in a thoughtful way.
Indeed. But when you get into this territory, this is much more intimate set of relationships than turn off the lights and put the tea bag in the right place. And it may be get away. You're talking about the kid getting away from mom or dad. And what does that mean to a 7-year-old kid in the midst? I mean, it presumably means talk to a teacher or do something of that sort. And I'm not saying anything.
No, I mean, it means exactly that. It means identifying who the people in your life are that you can go to. And many of the kids that we talk to say, I have no one. There is no one I can go to. And then it's really piecing together. Well,
data on bullying says that 90% of kids who are bullied do not talk to themselves. So we're in the same, right? We're in sort of the same terrain. Breaking down that culture is what you're really trying to.
Right. And setting those positive pathways early on.
And getting teachers who have not been trained in anything that would be thought of as social worker-esque behavior, and may be very uncomfortable in this whole area to figure out how they can relate both to the kids and to the parents, because they don't have a language with which to talk to often the kids about this stuff, and they often don't have a language to talk to parents at all.
Right. I think what you talked about is having cost-effective programming is really a critical issue and something that you guys might want to take a look at, because having these evidence-based models are extremely expensive to do and not something that is sustainable. We have a pretty high quality program at the center, and we do a Triple-P program, and it was a licensed social worker, 2 licensed social workers and a PhD that ended up doing the program. That's an incredibly expensive and not sustainable model, and yet that's what we needed to be able to actually make real change with families. And so how do you take this evidence-based model and put it into a funding stream that works? That's another movement area. I think we need to change the funding
This is
streams.
what, to me, Triple-P, and you're much more embedded in it than I am, but Triple-P as a program is interesting because it takes the public health, this is a medical model, but it's kind of
right.
medical/public health model. It's as if the way in which you stop people from smoking was you knocked on people's doors, there were smokers, there would be a nurse, the nurse was, or an expert, the expert would sit down with the individual, talk about why smoking is a bad thing, might even have a little course in non-smoking and would go to the next place. We didn't do that. That's the nurse-family partnership model. You spend, $8,000 a year for a bunch of very scripted lessons about a view of child development, which stops when the kid is 2 years old, and et cetera, et cetera. Useful, but awfully pricey. Triple-P, it's in a sense, it's a much more bloodless model. It's a population-based model. The question isn't, did that child who got that kind of loving attention, do better? The question is, what happened to the overall rates of hospitalization for injury and out-of-home placements as a result of basically an educate the professionals and inform the parents of the education that's available campaign. So they're really, Triple-P is focused on population-based change, the way an anti-smoking campaign or a drunk driving campaign is focused on that. And there's nothing, it's not that one is right or one is wrong, it's just that model, if you are working with the existing professionals in the community, is a whole lot cheaper to implement. And doesn't depend so much on the social services that are there. And it will leave lots of people are going to fall through the cracks in that model. But one of its great virtues to me is that it doesn't focus on problem parents or problem schools. It tries to inject itself in the parenting conversations generally. So the aspiration would be that parenting education of whatever level parents need is as common as well baby checkups. And what amazes me also, I have no idea how available all of the Triple-P programs are in any given place, but the array of problems for which they have developed evidence-based strategies is an evidence-based in that. So evidence-based does not mean, of the 100 and whatever folks that won studies in a nurse-family partnership kind of study. But if you compare Sydney, Australia, and Queensland, and Brisbane, Australia, you compare 11 rural counties in South Carolina that did and 11 that did not have Triple-P, you find impressive aggregate data at very low prices, because basically once you've done the basic training, you're doing some supplementary training along the way. It's like the world in which doctors or nurses or have to go back for further training every year in order to maintain their licenses. That's sort of what this is in a lot of ways, so that you get anybody working with kids who wants to be part of this, who wants this kind of training. Going through that, you've got quality control in the certifying process. It's an astonishing system, and again, I have no idea how it works on the ground in San Francisco, but looked at internationally, it's an astonishing system because it doesn't, in a sense, it doesn't run around the, if that's the right way of putting it, it doesn't end run around this problem because it doesn't try to get into the subtleties at the micro level. It really is trying to change behavior, parenting behavior at the more macro level.
I mean, that's definitely our experience with Triple-P. And there are different, obviously different levels of triple P, and it
Right.
allows you to, in the medical model, do primary prevention,
Yep.
but it also, and we do more of the tertiary prevention work, it allows you to go to the families who really are at risk. So we do level
Absolutely.
4
One of
work.
the great things about triple P is that unlike rural parenting programs, is a mare's nest of hostilities. You want to see a fight, just watch various of the programs that are out there, big national programs who argue with one another as to we're better than they are. Triple P is totally agnostic. Anybody can be part of a world which includes triple P. It's not threatening, and it's not threatened because you're the perfect example of this.
No, I mean, it's a great model. It is expensive to deliver. You were asking about how often are the services. You need to have a trained person. Triple P is a licensed program. You have to pay for a licensure. San Francisco is a community. The county Department of Children, Youth, and Family, and a couple of the other city departments have actually invested in training its family resource centers. But there's only one this year. They're trying to get more. But I think that how to get good models out there in an effective way and replicate them is really
and one of the big differences is triple P, a lot of triple P's concerns are the concerns that you as parents would have. My kid won't sleep, my kid won't eat, my kid is screaming, my kid is fighting with other kids, my kid is developmentally delayed and I don't know what to deal with her. I mean, that's a next level problem, but it's not problems of the severity that you're talking about. And there they do the whole gamut of things. But for those problems, you train lots of folks to be able to provide that kind of instruction to
we
families.
did a triple P class. It was our first one. We did it in San Francisco, and we had, as a celebration, a field trip to the zoo. Now, I don't know if you guys have been to the San Francisco Zoo, but in order to get into it, it's like Disneyland, you have to go through the store. Every time when I took my kids there, they're always clamoring, I want, right? So Triple P worked with parents to really set appropriate expectations. We're gonna get out of the car, you're gonna go to the store, you're gonna want to see something, you can touch 3 things, but you will not buy it, we don't have money to buy it, and we will then go see the lemurs. And then coming back, we will walk back, we will go through the store, you will want something and you can't do it. I thought that was the most brilliant thing.
Yeah.
I loved it, I used it, but amazingly, this was a mom who was terrified. She was a horrible life. She lived on the street. She was abused severely by every man in her life, and she was mentally ill. And when she had a child, her first child was taken away from her for Child Protective Services. Her second child, she waited a period of time. She desperately wanted to be a good mom, and she was terrified to go outside with her child. And so even one time she shuttered herself in her house with her 6-month-old and wouldn't leave. She went through the Triple P program. She went to the zoo. They had a wonderful time. And they came back, and she and her son just talked about this great day. And it's anecdotal, and I couldn't tell you a number on that, but that child and that mom had an amazing day, and they're better for it because of the Triple P kind of program that
Right.
teaches everyone universal stuff.
Wouldn't you like to come to dinner now? No, it's time to come to dinner. Just a little ways of phrasing messages as simple as that wind up working small miracles in many families' lives.
Have you, to what degree, have you seen, because I think you kind of talk about this, the possibility of it being replicated, and you also talk about the home visiting models being, more money being poured into that on the federal level. How has Triple P been picked up by the feds? What's
that's a very interesting question. You go to Australia, you can't find a corner of the country it's a Triple P country. And there are other parts, that's in a literal sense, it'd be very hard to not sort of encounter them. The feds, this is a category, it's an interesting category mistake. The feds got captivated by nurse-family partnership.
Yeah.
And we had to do a lot of work, not just about Triple P, but more generally. There are other ways of providing support for families other than nurse-family partnership. I happen not to be a fan of nurse-family partnership for a whole bunch of reasons, and including the quality of the evidence. But be that as it may, that certainly was not the Fed's role to say, we're going to spend $1 billion and we're going to give it to this one organization with this one model. And so triple P money, you correct me if I'm wrong, you can use that money for triple P, but it took a lot of, I mean, you have to bend the language more than you'd like to move away from the medical, I mean, it's basically a medical model statute. And you have to, that still is what was in the heads of the folks.
Which department funds it?
It's an HHS program.
Right. And we actually don't have access to triple P. I couldn't go to, and I probably could, but I couldn't go to triple P and ask for them to train our staff. I have to go through the city and county to do it. So they get their funding from HHS.
Yeah. Well, I mean, a lot of the stories that we look at and a lot of the good ones that the students have produced are really based on where the money's coming from and how it's administered. Because I think that, that's a quick way to always use the cudgel of coverage to get something to move quicker. So, so it goes down from this, it goes to the CDSS, who then funnels it down to DCYF, who then pays for the trainers themselves. But do they dole out grants to you guys or no?
So in San Francisco, and each community is going to be different, and don't quote me on this, I know I'm being filmed. My understanding of how it works is Department of Children, Youth, and Family, First Five, San Francisco, and Human Services Agency all pool their resources together in addition to Department of Public Health, and they contract with Triple P in order to provide training to the city. Family Resource Centers. I don't know where they're getting their money. I assume it's feds, but I don't know. Yes, Triple P is definitely an area to focus on with respect to funding. I would say children's mental health and family mental health in general is a really area to look at and shine the spotlight, particularly when you think about the Affordable Health Care Act. We have just recently gotten, within the last 2 years, a Medi-Cal grant, and we have found it extremely difficult to draw down the full amount of resources because the way that the program works, it's not a family-based model. So for example, if you have a child who, in order to get Medi-Cal, you need to prove one of the components is medical necessity. Therefore, if you have a family who is in an abusive situation, may need mental health interventions, maybe one of the parents is has a substance abuse issue, you have to diagnose the baby. Let's say they have a little one. You have to diagnose the little one with some kind of medical necessity. And that could be stigmatizing long term, but how do you prove that a 2-year-old has ADHD, for example, or something else? But the only way to get the funding is by diagnosing the child. Alternatively, you could provide substance abuse for the parent, but it's in an adult parent program that is very unchild friendly, typically. Typically, they don't, this is not across the board, but typically they don't have child care provided, and so it's very difficult for parents to get intervention services that they need paid for. So I think there's a real opportunity to shine a spotlight on funding problems on this particular area.
So you'd say that the story there is that you have to start diagnosing little kids really early to be able to get the funding from ACA on this. I think organizations are doing a lot of creative diagnoses in order to ensure that their families can get the support that they need. And I would say I'm hesitating because we're not good at it. We're actually we leave 30%. We only draw down 30% of our funding. But I think that the story would be to go to the agencies that are really good at it and ask how they do it.
Sorry, could you clarify, when you're saying they're devising the creative solutions, what particular funding are they getting if they are able to do so?
Medi-Cal.
Medi-Cal, okay.
It's Medi-Cal funding.
And it's dependent on, sorry, you said the child needs to have some sort of diagnosis?
So the child needs to have a diagnosis to be a medical necessity. The family itself has to have, it's a means-tested program, so they have to be at a certain income level. Mm-hmm. And the services that you're providing have to meet that medical necessity. So let's use the example, and I'm not a clinician, and so forgive me, and that's why it's important to talk to people who actually know this stuff other than me. Let's say you want to get services to a family, and one of the parents has a substance abuse issue. David, I'm curious if you've seen this type of issue, but the services so you diagnose the 2-year-old with ADHD. Then the support services counseling services that you're providing also need to support the ADHD. And then you can support the parent in the substance abuse issue, but it's sort of collateral to the overall issue. And what you really want to do is look at the family holistically and say, what does a family need? And then be able to provide all the different types of services that you're doing, as opposed to this sort of, in that example, sort of a piecemeal approach. So I don't know if you...
No, this is a generic problem with social services and education for that matter. Slice and dice.
Slicing and dicing.
Trace it back, you find some now dead legislator who got credit for having created this little trickle as part of the stream. We're stuck with it until somebody comes along and says,
right. From the nonprofit world, we call it blended funding streams, and so. And
you're right. I mean, in the public sector as well as the nonprofit sector, people are very creative in the ways they do that funding. But the transaction costs are huge. I mean, it's, you get good at it, but this is not a skill that you ought to have developed.
No, I mean, in order for us to really, we have been advised, in order for us to effectively draw down our funding, we should hire a lot more people to do billing. I'd rather hire people to provide services.
Yeah,
so instead, we fundraise privately, private dollars, to support our services.
So say that the child is diagnosed with ADHD. At what point do they get out of the system then with that ADHD title given to them? Do they continue to have social service workers test them at age 3, 4, 5, 6, 7 until finally they're like, they don't need this service anymore, we could just remove that label?
It's a great question. I don't know the answer to it. The records are supposed to be confidential under HIPAA, so, but there is a fear both from clinicians and from parents having a label put on them. But in reality, is that information getting out there? I don't know. Do insurance companies see it? I don't know.
Lauren?
I'm just curious. I think I'm just a bit confused why or where these families are going to get these holistic services for each family members. I know currently, I believe if you apply to TANF, which is means tested, I'm pretty sure your children automatically are enrolled in Medicaid. And so when they receive the services that way, what would be the purpose of diagnosing with ADHD like a 2-year-old if they weren't meant to be getting services for that particular diagnosis, like IVs, therapies, or medication? And then in terms of the diagnosis following them, it's usually after 18. Now, if you get diagnosed when you're an adult, that'll stay in your record forever, and anyone working with you will see that. But I'm just curious, what services they'd be going after that would they need these diagnoses to come out of the children for mom to get services?
Right. Well, for example, we don't take TANF dollars. We don't have the back-end support to do that kind of work. So, but there are other agencies that do. So if a family wanted to, and families come to us in a bunch of different ways, but for example, we run a 24/7 phone support line. It's called the Talk Line. Anyone can call 24/7 and reach somebody to support us. And a relationship's connected. We run it through volunteers. It's relatively inexpensive to do. There's no public funding stream I'm aware of that would actually pay for that service. So we provide it privately. But a family is creating a relationship with the organization, and so they may want to continue on with services with us. And if they come with TANF dollars or something else, we don't. Another agency does have that service, but then we're referring to that other agency, and they may or may not have a child abuse prevention lens. They may have for example, a homeless lens or a substance abuse lens. That's great, and they're probably getting fantastic services, but the mission of the Child Abuse Prevention Center is to prevent child abuse. So I get concerned when the services don't have that kind of family support holistic lens. But it's a really good question. I mean, I was just talking to a colleague of mine, and that somebody a new person over at San Francisco's DPH is saying, we need a primer. Like, we need to know how all these funding streams work, because we're all sort of trying to match that. And so how does TANF impact this is really important.
I mean, it's interesting. So I'm just coming at, so there's the local control funding formula. Now let's just go to education policy in California, right? So the governor has this big plan to simplify the way we fund education and all the rest. In that whole calculus, the use of the term foster care youth was thrown out there as, an at-risk group that needs certain things, and really they're not really getting any extra money because they're already categorically eligible for free and reduced lunch, one of the other 3 groups that were going to get special concentration grants in the funding. So anyway, there's a big coalition of advocates who are trying to put together a package where now you double count those kids. Okay. And so then when the conversation comes up, how explicit do you want to be in terms of what you say they're planning for a hearing in early May? And, I'm telling them they should be very explicit in exactly what they want from this funding stream and really say what they want. And the reaction is, well, no, I don't think that they are going to get it, the legislators. And the press definitely won't get it. So, and my reaction was, well, I have this kind of sick conception that maybe the press can actually understand some kind of complex things. But to what degree do you think that you in the nonprofit field and people who understand policy very well, I mean, to what degree, and this it's a kind of rhetorical question, but I mean, to what degree can we actually explain this stuff in a more not be so afraid to really explain things very deeply? And I'm wondering, you sent us that piece you did with Cheryl Jennings, and that was pretty deep explanatory stuff of what you did. But I'm wondering how dedicated are you to communicating all these things, and also the deep parts of these things, the kind of difficult parts of these things, the funding stream parts of these things that people you may think are not interesting to journalists, but maybe are.
No, this funding issue, frankly, is very wonky, and it's. I got into it because my job as an executive director is to fundraise. That's it. I have a lot of other things that I may or may not want to dabble in, but fundraising is my key component. And what I was finding was I would go to private folks and say, can you support our work? And they would say, well, do you have Medi-Cal dollars? And I said, no. And they said, well, go get Medi-Cal dollars. So I went and got Medi-Cal dollars, and now we're not able to do it. And now sort of seeing some of the nuances of why we're not able to do it. Now, part of it, 100%, is we need to get better at drawing down dollars. So that's an internal thing that we're focused on. But there are structural issues that need to change. And this is a very ripe time to have these conversations, particularly, I think, because of the Affordable Care Act. And the challenge will be pulling people together to really both understand it from the 30-second soundbite, but at the fundamental level, be able to have a conversation at a much more detailed level so that policymakers can understand how to make the change. But we have examples of doing that. I mean, the Affordable Care Act is one of them. Right? I mean, that's a massive piece of legislation. And whether or not you agree with it or not, a lot of people got very sophisticated on how to write that law. So,
but that's a perfect example of a badly communicated law. I mean, is this really going to surprise you? If I was going to try to write a story about funding streams, God help me, I would not write a story about funding streams.
No.
I'd write a story about an individual.
Right.
And I would talk about this individual and the family and their problems, and then what they had to go a backward map and say, look what's happening. Look at why they're not getting services. It's got this crazy system. Then you've got people invested in the story, and you might sneak in a bit of wonkishness and then tell another story. But it's about stories. This is the world of folks who care about this stuff in detail. You could sit around this table. You would have you would have done California in this room, and at that level. Why is that an inappropriate? Why should people, ordinary folks, reading a newspaper, listening to the news, going down the NPR road, or reading, the sort of standard blogs? Why would you expect them to dig around in this? What they need to know is that that the reason this family and families like this are getting shortchanged is because we've got this crazy system which somehow says there's a category called homeless families. And there's a category called, abuse in the family. and they're different, and it depends on which lever you're gonna push, or which frame you're gonna use as to where it is that you're operating. To flag the craziness of a system that parses families and kids out in this weird way, in the broadest sense, seems to be fine. Got to do something. Got to do something to simplify the world. That's all I could have imagined anybody hoping to do in any publication that wasn't addressed to the 87 people who would read the detailed regs in this story.
But you are using the stories to create public will and movement.
Yeah,
So if somebody hears the NPR story and then they call Daryl Steinberg up in Sacramento and say, you know what, I really care about children's mental health, and then if all the people sitting around this room can say, great, Daryl, we need you to carry the bill, that changes
Right.
legislation.
The stories need to be contextualized, as you know. You can tell a story all by itself. I don't know, you guys read Iyengar? Are you going to read Iyengar?
No.
Okay, you should read this guy. Really, you just take a story, and people say, this is an isolated, interesting case, thank you, I'm out of here. If you use a story to illustrate a larger problem, then people are going to pick up the phone and call Daryl Steinberg's office and say, we need to do something about this problem. The story was the prompt that got them in to being willing to hear a bit more about the fact this isn't just an isolated case. This is the way 7,000 families were denied services because just like the Jones family, they didn't fit this category.
Well, and another sad issue that's bringing this to prominence is obviously what happened in Connecticut. And because of Newtown, there is a view not just around gun control, but around children's mental health and how to think about children's mental health in a holistic way. And so it's different from child abuse, but I fundamentally believe solving the funding stream, and it's really wonky, solving the funding stream around children's mental health and family mental health will change how we think about families and child abuse and prevention of that. Now it's a couple steps to get there, but any hook to create that story is really
Why shouldn't there be a one-stop family problem place?
Interesting that you say that.
What are you going to tell the Center for
So
Youth
one of
Wellness?
the things that we're doing in San Francisco, and you guys met with Susie Loftus last week, is we're creating a center in San Francisco that will deal with victims of trauma and violence in the community across the board, very broadly defined, from primary care to acute care. And so we have this model that Dr. Burke and I spent a lot of time working on early on around focused on tertiary care, that's acute care, there's an emergency, it's a child abuse report, you've got to provide supportive services for the family, to identifying kids earlier on, and that's through a pediatric center doing adverse childhood experiences, screenings, identifying the kids that are below the iceberg, for example, below that sort of the known cases, and so that we're going to be all under one roof, and we're building on 3rd Street in the Bayview, be able to have this comprehensive center to provide those kind of services. Center for Youth Wellness is focused on I don't know what color that is, green areas, secondary and primary prevention, and the San Francisco Child Abuse Prevention Center is creating a children's advocacy center, and we're focused on the tertiary care, working with the government partners to ensure that those kids are provided the services that they need if there is an actual substantiated case of child abuse.
So that's the 3rd floor, right? I mean, they're on 3 floors, right?
Yep.
So you guys are going to be housed on that.
We're on, currently the work is being done for the acute care work in the basement of General Hospital. It's sort of lemony snicket. It's sort of this horrible place, but amazing providers doing the work. You have to go through a methadone clinic to get there. Literally.
Is that the case there?
Yes. But the folks that work there are amazing, and so we're taking that work and ensuring that we have police, city attorney, district attorney on site to be able to provide all the government services under one roof. So that's on the 3rd floor. So we're going from the basement to the 3rd floor, which we're really excited about. And then on the 2nd floor, we're having the CPMC's Bayview Child Health Center pediatric clinic, as well as a Center for Youth Wellness that Susie and Dr. Burke, Nadine do a lot of work in for long-term mental health support. And that's on the 2nd floor.
So you write in your book about this idea of the many flowers, right? This is a world of all flowers should bloom. or something like that, right? And this idea that we have all these great ideas that are out there that we should, that we should allow them to be, and that's of course the movement in terms of how we fund things from a federal level is trying to get them less prescriptive and more flexibility, quote unquote, to do these kind of things. So you hear something like what they're going to do for the Center for Youth Wellness, and Daniel, of course, was very clear about not wanting to replicate ahead of its success. But how do you turn good ideas into broader programs that have some fidelity? And to what degree is it the government's role to be strict in terms of, because at what point do we start going back to a more prescriptive federal government that says this is exactly what you need to do in terms of implementing this program, or to what degree can we pull back and let all those flowers bloom? So, I mean, that's something you bring up in the book, and I'm just wondering.
Well, we live in depending on where you are and what category you happen to fit in, at what moment in time, you're going to get very different services. You're living across the line in South San Francisco. None of this is going to apply. That's a very weird world. So more generally, I think great programs are wonderful, but I'm interested in building solid systems, which may not be as great as the great programs, but actually going to reach lots of folks. And my favorite story doesn't come from this area because, this is, you've forgotten more than I'm ever going to know about this terrain. But it comes from education, where I do know something. And there's a program there's something called the Dream Foundation. The Dream Foundation, all around the country, lots of rich folks come together. They support a class of kids, sometimes now even at the beginning to support an entire school of kids. 1 year, identified in 3rd grade, they get mentoring and they get activities along the way, and if they make it to college, they get a guaranteed last dollar funding. And I went to one of their fundraisers, and this wonderful woman from NYU said, I was really fortunate because I was living, in this particular neighborhood in Brooklyn. I was going to this class, and they came and they found us, and without this, I'd never be at NYU. And I thought, exactly, that's what's wrong with this. It's a lovely program, but it's not a system. Her little brother, who's a year or two younger, out of luck. She lived a block away, out of luck. So that's why I'm much more focused on thinking about what's durable. It's a greatest good for greatest number of things. What's replicable, what's durable. Not going to be as fancy. There'll be a lot of stuff that falls through the cracks in this story. There'll be a lot of unhappy tales. The population as a whole will be better off.
Does durability come from a government system? When you say change the system, is it a government system or a?
If I think about schools, which is again the terrain that I know best, there isn't any. All the success story countries in the world that the critics of public education point to are all school systems run publicly. You cannot educate 60 million kids in a hodgepodge of vouchers and charter schools, etc. It does not mean I think charter schools are a bad thing. It means that you've got to build out a solid public school system, and that is, as you know, the sort of work that I've been about recently. This is not an area in which I know the answer to that, but I will say my bias would be yes, and it comes out of my experience 30 years ago with the AIDS crisis. We, AIDS activists, hated the public health bureaucracy. They couldn't do it, they were unresponsive, they were old-fashioned, they were homophobic, they were this, that, and the other thing. We were going to build a parallel system, and it was going to provide great treatment for folks. Fast forward not all that many years, and what you've got is a public health system which has gotten a lot better over time, and a handful of private organizations that are there, and the realization that you could not take care of HIV with a patchwork of well-meaning nonprofit organizations. You needed a system to be able to do this. And yeah, one of the virtue and vice of a bureaucracy, is that it can standardize services across a large realm. And the trick is to standardize services at a level that is decent and not inexcusably bad. And that's a problem in this area. It's a problem in education. It's a problem in any domain, whether you're talking about kids or grown-ups that involves changing people, which is what all this is about. You're changing the arc of people's lives. And whether it's housing or education or abuse prevention or foster care, whatever it is, the underlying dilemma of durability, replicability is the same dilemma. And I've spent a lot of time now trying to think about this in the education context. And you were saying before, I mean, this is the big question. How do you devise a Kia in this story? So I'm told there's great work to be done, at the individual program level, and it's important work. And I would never ever want to minimize that in any way, shape, or form. If I think about where I'd like to, sort of invest large numbers of resources, it's building out a system.
Completely agree with that, 100%. I think the role of nonprofits and private philanthropy is to be innovative, but then to be sustainable, you have to go into a government system. So a Children's Advocacy Center is actually a well-known model. It's a term of art. There are actually 800 children's advocacy centers across the country, but not in San Francisco. Alameda has Calico. It is, at its very essence, a place where you can do an interview with a child, and all the people who need to hear that child's story are behind a one-way mirror, and the child is just speaking to a interviewer who is really good at talking to kids in a non-leading, non-suggestive way, and so that you can then prosecute those cases appropriately. More importantly, and I think here's where the innovation comes in San Francisco, is the field in this area. Children's Advocacy Centers started about a decade ago, some great ones in New York and Dallas and Chicago. Everyone is realizing it's not about prosecution of these cases, it's around long-term mental health support. And so everyone in the field is now trying to create models to create this long-term mental health, which is why we're so excited about partnering with the Center for Youth Wellness. I mean, we're two separate agencies, but we're partnering with Center for Youth Wellness because, one, they're going to be able to identify the kids, and two, they're going to be able to provide long-term, really effective mental health services.
And it's the second, unfortunately, that across the country, I doubt that Dallas is really going to be able to do that. Maybe they are, but Texas is notoriously tight-fisted when it comes to any public programs to identify, right?
Yep.
We were talking earlier about the use of Ritalin in poor communities as a way of concentrating the attention of kids who in classes of 40 or 45 can't learn. So instead of providing decent resources to them, you Ritalinize them. In effect, if there are many folks who'd be tempted to Ritalinize this population as well, and it's just, to me, it's an immoral way to proceed. So you've identified, once you identify the problem, then you need to figure out some way of translating that need to get public support behind what it is that you're.
Which is one of the things we talked about, screening at the very beginning of this, and one of the concerns around screening for adverse childhood experiences is, well, what do you do if you find out that a child actually has significant adverse childhood experiences? There's no system to be able to actually deal with that. And that's why pediatricians are actually, many are terrified to begin asking the questions, because what do you do if your patient's there and says, yeah, I'm actually a victim of domestic violence. Actually, all these things are going on in my house right now. What do you do with that?
Well, I mean, that's like the Minnesota model when they just turn away from it. Hey, we don't want to deal with all these child abuse. We're just going to get rid of that statute. Jesus, that actually opened up the floodgates. And that's, I think that to a certain degree, it's going to, there was early on in this class, there was some conversation about mapping, ideas about mapping, but you start mapping neighborhoods, you map places for the prevalence of adverse childhood experiences, and you at least, regardless of all the kind of social implications of doing something like that, at least you can see the enormity of the problem. And I think that, but you're right, there is no system to catch them.
One about mapping. This is the British Columbia model that mapped, that particular model mapped child problem as identified by kindergarten teacher against availability of services for little kids. Very powerful. The imagery of that is very powerful. But I want to just second the point that you made about the use of nonprofits as existence proof. When Bill Gates and other folks like Bill Gates come and say, we're going to have an Educare, early education center here. Educare is an impossibly expensive model. It's a $20,000 a year model. It's a birth to 5 model. It's great. And I'm glad there are Educares around and supported by powerful folks who can say, look, this is what you can do, and look at these results. So you may not do Educare, but don't think that this entire population of kids is somehow to be wastebasketed. Look at the great results that we've had. Let's think through what it is that we're about doing. I think that's the very best use you can make of nonprofit money, to actually to be the Cadillac in a way that says, look, this can work, and then to start thinking about, okay, what can we pare down? Because one of the difficulties of any of these social service strategies is they're multi-pronged. So you try to say, is it that part of the program or that part of the program that actually made a difference? What do we need to replicate? And this is not like a lab, right, in which you can just take the petri dish and remove one item and add one item and see what you get. This is, people specific, and even in a model as prescriptive as nurse-family partnership. When I went out with those nurses, what they do bears a reasonable resemblance to what it is that they're, quote, supposed to be doing, but it bears a much more solid resemblance to what they need to be doing.
Yeah.
And what they need to be doing varies with the family, with the moment in the family. If the boyfriend has just left and the mom is a wreck, the lesson on identifying emotional malfunctions in your child is not going to work. And you have to sort of be there for that. So figuring out what elements of a good program are the essential elements for success, but starting with what you think is the program that's going to be the best you can, and then trying to pare down and figure out what you have is a useful thing to do. Because it's a way of breaking out of the poor kids get poor programs, which has been the world in which we have lived for a very long time.
And Educare is a great example, because one of the things that they're doing is they probably do potentially have the resources to replicate a lot, but they are intentionally keeping themselves at a place where they rely on public funding streams, and they want to ramp up the public funding streams before they start building these Cadillac programs. And I think that's the tension: is how do you scale programs without creating raised expectations in communities that just can't sustain them.
Well, isn't that going to be, I guess, one of the problems going forward? Because I would assume 20 years ago, even 15 years ago, there were so many barriers between getting this dialogue. You'd have to wait on someone to do a study, and then that study would have to be published. But now you can have, communication between all these different partners, and with the internet, with the speed of information, we could see things as they develop. That when they have a good idea and when people are starting to verify that with facts, it's going to be a race to dollars. It's just going to be a race to find funding. So how does something like this get to go to a Stockton and a Vallejo that's bankrupt, and they might see this idea working? Are you going to have long-term savings plans?
Well, again, I want to say San Francisco is actually behind the times on the creation of a Children's Advocacy Center. Every major city in the country has a Children's Advocacy Center, except Stockton, Vallejo, Salinas. They actually have them. We don't. But your point is well taken, and that one of the reasons why we, but they don't have, they don't have this expanded sort of one-stop shop concept on primary care and mental health services. One of the ways that I think is really effective is looking at the rate of return on programs. And so Children's Advocacy Centers, for example, show a 41% cost savings in municipalities that have Children's Advocacy Centers versus those that don't, literally just on the, there's something magic about having everyone under one roof and sharing the water cooler and sharing those stories about, for the cops, do you know what's happening over at this family, Child Protective Service, and literally getting them in the same room so they're not driving across town. Which in San Francisco isn't that big, but if you think of LA, that's 2.5 hours, right? So, and I think that's going to be the kind of argument that appeals to a lot of legislators and philanthropists on, well, okay, great, this is a great cost savings program. In addition to it's evidence-based and it just works.
And that's where I see the triple P really starting to ramp up, is that once people get their cost-benefit analysis into it, you're like, okay, we are saving it on the back end. If we just put all this money into primary care, and we don't have to worry about them needing all these social services when they're 18, when they're 15.
Yeah, but that's different. That's a difficult sell for legislators. It's somebody else. Somebody else is going to take the credit. You're going to be paying out the dollars. We, increasingly, that we live in such an impatient society makes it very difficult to test out an idea. If, to repeat something that I said to folks who were here for part one of this this two-part movie, If Perry Preschool, which is the exhibit number 1 in the argument for the long-term effect of preschool, that's a 40-year piece of research. You can't get 40 months worth of research now. And I mean that not rhetorically. It'd be very hard to get research that took you from pre-K beyond 3rd grade. If the Perry Preschool research had stopped at 3rd grade, Perry Preschool was a failure. You'd never have that impetus to do early education. So we're in a very difficult time, and this is certainly true in education reform, that the enemy of progress is churn, is impatience. I don't care how brilliant the ideas of Superintendent X or Principal Y. If she's out the door in 2.8 years, which is the average in big cities, nothing is going to happen. And here, right, if you don't show immediate payoff, and there are big upfront costs, very hard to persuade politicians.
Well, and you look at preschool in California. Our history of trying to get preschool, universal preschool in California, has not been a good one, even though we have all the models, Abecedarian, Perry Preschool. I mean, early care is a wonderful prevention model, and it's cost effective, and yet we don't do it.
And notice how we're sneaking in the back door in a way that makes not very much policy sense, but you have this thing called early kindergarten, which is preschool for the 3-month period before kindergarten, but because it was called early kindergarten and because they could slip it by. It's the largest pre-K program in the state. The state of Texas, by the way. This is how bad policy gets made out of necessity. We do it all the time. We target, we have initiatives to fund activity X, which any policy person will die about, as opposed to general support for government with legislators making these decisions. In Texas, which was busily cutting its budget for the umpteenth year, they expanded preschool a couple of years ago. How did they do this? My smart advocate friend decided that he would get a measure introduced that would provide free preschool to the kids of soldiers serving in Afghanistan and Iraq, and the folks who were the kids of veterans of Afghanistan and Iraq. Passed unanimously. Who is going to oppose this? So the thought was, okay, next time around, let's look at the policemen and the firemen and and then eventually you're going to get that. This isn't how they teach you public policy at the Goldman School, but it turns out in these miserably straitened times to be the kind of cleverness that people need to manage to pull off, and that's going to be true in any area of policy. Finding the angle that adds money in a terrible time is often the best that we can do.
Well, and getting back to child abuse prevention, one of the angles I think is an opportunity is there is such a focus on education. I mean,
right.
It is the hot thing that people are funding, people are focused on, from policy to private to individual dollars. And so I've begun talking about the fact that, and it's really the reason I went into the child abuse world, because my background is education, is if you want to get kids graduating, if you want to get them ready to learn, if you want to get them with 3rd grade reading levels at a high rate, you've got to focus on family dynamics, because a child is not going to be able to learn algebra if they're terrified to go home, and they're not going to be able to learn how to read if they don't have food in their belly. And so if you really want to solve the graduation issue, you've got to start focusing on what's going on in the home.
I mean, yeah, I wondered with ESEA gonna hopefully roll at some point, whether they're ever gonna get back to that whole thing. To what degree, us wily advocates can slip certain things in there for our child abuse prevention side of things.
Well, but I mean, if you're thinking about who are media outlets to go to, you may have to think of some unlikely suspects. It may be people that are much more focused on education or the economy or criminal justice than it is on let's talk about the family and let's talk about these kids.
I'm glad you brought that up. For a lot of the students now that are working on their stories, what alternative media do you find, and how do you find them? Like, is it just looking at people who show interest in you first, or you guys have people specifically that kind of rake the media field for someone that could advocate for your cause?
Oh, I wish I had a good answer. We're horrible at it. I mean, it's whoever comes to us. you know, I wish we were strategic about it. We're looking at social media, if that's a particular avenue. We're looking at different news outlets. But one of the, a strategic objective for the organization, I'm just being really honest, is to get more savvy around communication and marketing. And we just don't have the resources to do it right now.
Well, yeah, I mean, I'll tell you, we've got a bunch of students here who are very good writers, which I can attest to. So hopefully you'll be kind enough to.
I should have said that. You guys are my.
Yeah.
Let's create a partnership. Let's get the word out.
But in respect of you know, my guest time, we'll wrap up. But I mean, it would be nice if David, I don't know to the degree you're happy to talk to students also, but you know, we're researching stuff all the time. I know that there's been a lot of interest in Triple P and other things. So, and also, Katie, if we could reach out to you too, because I think that as this ramps up, especially over the summer and then into the fall of next year, there's going to be lots of stories.
I'd love that. And we're right in the Haight in San Francisco currently, and happy to give tours and
good narrative
introduce
piece
folks.
For somebody.
It's a beautiful Victorian firehouse.
I even emailed Susie and asked her if we could start getting closer and getting a tour of.
Yeah, and we can give a tour. This is about to go under construction, so wear your hard hat.
Any final thoughts?
Thanks for having us.
Yeah, this is great.
Thank you very much. Thank you.